periodontitis, inflammation of the gums, underlying soft tissue, and bones surrounding the teeth, is linked with type 2 diabetes. Both conditions include some of the same biochemical reactions in the body. In April 2015, the Journal of Indian Society of Periodontology reported the results of a study on scaling and root planning and the changes in blood chemistry that occurred afterwards. Researchers at SDM College of Dental Sciences and Hospital in Dharwad, Kamakhya, India, divided 45 participants into 3 groups of 15 individuals each. Group 1 was made up of healthy controls. Group 2 was made up of participants with chronic inflammation of their gums and underlying tissues. Group 3 was formed of people with chronic periodontitis and who had been diagnosed with type 2 diabetes. 6 months after scaling and plaque removal, improvements were seen in the third group's dental and metabolic health. Their gums were less detached from their teeth, and their teeth were better attached to the underlying tissue. Group 3 also showed a link between the degree of periodontitis and HbA1c levels. A molecule called interleukin-10 went up in both groups 2 and 3. The investigators concluded scaling and root planning helped reduce blood sugar levels and also helped to lift the levels of IL-10 in the participants with chronic periodontitis alone and those with chronic periodontitis along with type 2 diabetes. IL-10 is one of a family of molecules called cytokines. Unlike many other cytokines, IL-10 is anti-inflammatory. It is also called cytokine synthesis inhibitory factor, or CSIF. It inhibits 3 types of white blood cells involved in inflammation and immunity, slowing down and stopping the immune response when invaders have been neutralized. It also helps stem cells to change into various types of white blood cells, nerve cells, hair and nails, and blood vessel cells. It is thought to play a key role in immunity to certain viruses. All of which is to say effective treatment of inflammation of the gums and underlying tissues is a good way to help get your blood sugar under control. Type 2 diabetics need to visit their dentists for professional cleaning at least twice a year and more frequently as recommended. In between visits, it's essential to brush your teeth with a soft bristled toothbrush after every meal and snack. Replace toothbrushes every 3 months. A good way to remember when to replace them is to make it one of your jobs at the beginning of each season. Floss once or twice a day, taking care to pull the floss a bit below the gum line. When visiting a dentist or periodontist, try to have your blood sugar in goal range.